There it is. Thank you, Penny. Well, good afternoon, everyone. Welcome to Health Equity and Access Response Team for COVID-19. I'm Dave Roth. Here, first are four things about this meeting. It's a Zoom meeting. We're being live streamed to the public. We get a chance to build our team here and be transparent out there at the same time. The meeting is being recorded, so all of our members and participants can stay engaged. Please mute yourself when you're not speaking. Be aware of background noises. Fourth, because we are building a team here and we're making great progress at that, I'm encouraging you to keep your video on as much as you're comfortable to get to know each other. I want to remind us that the Health Equity and Access Response Team for COVID-19 has three identifying features. The first is we are an intentionally diverse group, and we are creating new solutions from our diversity so that as we respond to COVID-19 as a community, the entire community achieves optimal health and no one is disadvantaged. Second, we're intentionally taking the solutions beyond the world of public health and healthcare. We're engaging business, human service providers, religion, civic association, government at all levels, so that all of us work together to change our habits and our ways of doing business so that everyone gets to have the best health possible. Third, we strongly work from the data that's available to us, and that data has been disaggregated by race and ethnicity and by other identities. So today, we want to do four things. First, we want to welcome new participants to the team and continue to build relationship and trust. So here is a heads up to everyone. If you are new on this call or with this group today, I want to give you a heads up that in a couple of minutes, I'm going to invite you to introduce yourself, tell us your affiliation or your connection, and then help us understand why being at this meeting is important to you. The second thing we're going to do is go back to the data. Chris Hoff of the DuPage County Health Department is going to give us an update on vaccination. And we're going to take some time to do discussion around that as well. Number three, we're going to do some work ourselves to build engagement among ourselves and our constituents around a fantastic survey outreach tool that has been created. And Kara and Mimi will guide us through that, the way in which we can get that out to our constituents in the languages that we determined last time when we met were going to be necessary for this to be successful so that we can have a robust response to COVID-19. Fourth, we're going to look at new opportunities for us as leaders to engage our constituents to promote upcoming events regarding COVID and vaccination, and so look at promoting new communication tools that are developed or in development. Now for introductions. So we have developed some good trust and familiarity, and we want to extend that to new participants who are joining us this afternoon. So now I invite you, if you are on the call for the first time, will you unmute yourself and introduce yourself, your name, your affiliation or role, and why it's important for you to be here today. Now, I see a couple of county board members particularly. Welcome. We're so glad to have you with us, and we invite you to introduce yourselves.
Oh, well, I guess I'll start.
Thank you.
Hi, I'm Liz Chaplin. I'm on the DuPage County Board, and I represent District 2, which is parts of Elmhurst, Villa Park, Oakbrook Terrace, Hinsdale, Westmont, Downers Grove, Lisle, Woodridge, Clarendon Hills. I think a little bit of Milton Township's in there too. So I think I hit all the areas that that I represent. I'm here today to learn a little bit more about the vaccination and how to help my constituents get the vaccination. So that's what I really want to learn today. And, we did have a clinic in my district this morning. 110 senior citizens got vaccinated. So thanks, Karen. I don't know if Karen Ayala is on here, but shout out. So that's why I'm here to help with that effort.
Very good. Welcome. I see Member Garcia. I see Member Desart. Would you introduce yourselves?
Sure. Can you hear me? Yes. I am also a county board member from District 2, just like Liz, so I won't repeat all the cities that we represent. I am mostly here to learn the best way to get the information out to everyone. We need to get everybody vaccinated. That just goes without saying. So this is what I'm here to learn, the best way to do that, and I'm excited to learn. Thanks.
Very good. Welcome.
Thanks.
Hello, my name is Dawn Desarge. I'm DuPage County Board Member from District 5, which is all of the DuPage portion of Naperville, a little bit of Lyle, a little bit of Warrenville, and I am just here to learn as well.
Good. Welcome.
Thank you.
Others who are here for the first time, would you be willing to identify yourselves and help us get to know you?
Member Ozog is here as well.
Member Ozog, welcome. You're not showing on my screen, so I'm going to encourage you to share with us anything that you'd like to about what brings you here today. And we'll give you plenty of time to unmute yourself and come back to you as we can. Are there others here who are here for the first time who will introduce themselves?
David, I think Member Ozog is back. I think she maybe switched or logged in differently. Member Ozog, would you like to? Oh, whoops.
I'm back. I'm
Great.
here.
Back. Welcome. Welcome. And we're encouraging you to introduce yourself. Tell us, I see you've gone back to mute, but tell us a little bit about what brings you here today.
I'm a representative for DuPage County Board 4, and I'm here for the same reason we're all here. Everyone, vaccinations, that's what we're interested in. So thank you.
Thanks. Others who are here for the first time.
I can go next.
Thank you.
So I'm Claudia Valenzuela. I am from Pillars Community Health, and we're located in different places. My primary location is here in LaGrange, and we're currently standing up a vaccine clinic. So just here to learn best practices, what the challenges are, so that we can be as transparent as possible with anyone that we're vaccinating or anybody that is calling in for information.
Very good. Thanks for being here.
Hi, Dave. I'll go next. Jenny Fabian with People's Resource Center, and we serve a wide variety of communities all across DuPage County. So I'm interested in resources to help folks who are coming to our food pantry and our online classes connect with vaccines, as well as for our frontline food pantry workers in Group 1B that are struggling to find vaccines themselves. Glad to be here.
Good. It's the right table. Thanks, Jenny. Welcome.
And I will just say hello too. This is my first meeting. Jane McDonald. I'm with Loaves and Fishes Community Services, working along with Jenny in DuPage County to make sure we get our constituents back vaccinated and that everybody understands how they can access the vaccine.
Very good. Welcome, Jane. Are there others here who would like to introduce themselves?
Hi, I can go next.
Thank you.
I'm Judith. I'm an intern for Senator Villa's office, and I'm just here to learn information that we can communicate to our constituents about.
Welcome, Judith. Others?
I guess I'll go next. My name's Brian Delphi, and I'm the benefits director at Navistar. We're located in Lisle, and I'm here to learn.
Good. Welcome. It's good to have you here.
Thank you.
Others who are here for the first time, I want to introduce you encourage you to introduce yourselves. Thanks.
Hi, my name is Leanne Cornelius. I work with Brian and Glee at Navistar.
Welcome, Leon. It's good
Thank
to
you.
have you here.
Thank you.
All right. If there are others that I've missed, we can certainly get you in as we move along. At this point, I want to bring Chris Hoff to the mic for an update from the DuPage County Health Department regarding vaccination.
Thanks, Dave.
Thanks, Chris.
Get the update up and just confirm that you can see what I see. Do you see a full screen presentation?
We see a presenter view.
Okay. All right.
You got it.
Excellent. Well, thank you, Dave. And hi, everybody. My name is Chris Hoff. I'm the Director of Community Health Resources at the DuPage County Health Department. As we have in previous meetings, I'm going to give you a quick update on vaccine distribution progress and a look ahead at what we expect over the next few weeks, and then happy to take questions, and we'll definitely share slides with you so you can share with your stakeholders and clients whatever information is appropriate. So just want to remind everybody that our goal in this vaccine campaign is to make vaccine available to every person that wants it, and we will be able to do that as the vaccine supply increases over time. DuPage has about 922,000 people. We're hoping to get at least 80% of those over 18 at this point with the vaccines that we have vaccinated. And so that represents a little bit over 500,000 people. As of today, over 132,000 DuPage County residents have received at least one dose. So I know it feels frustrating. And if you haven't gotten vaccine or you have clients that haven't been vaccinated, everyone is frustrated until they can be vaccinated. We are making progress, and we're making progress collectively with health systems, FQHCs, pharmacies, and we know it's not enough. We're not to the point of having everybody vaccinated, but do want to reassure you and reassure you, your clients through you and your stakeholders that people are being vaccinated. As of today, almost 54,000 people have been fully protected with 2 doses, which is an incredible milestone when you think about how far we've come over the past year of this pandemic. Some key messages, if nothing else from this presentation, here's kind of the key things to walk away with. One is that we're very focused right now on making sure that we get to everybody in that 1B group. So individuals over 65 and frontline essential workers. In DuPage County, that's about 270,000 people. We need to get those folks vaccinated before we move on to the next group, or at least a substantial number. Unfortunately, we received 4,510 doses of vaccine this week. Next week, we expect a little bit more, a little over 8,000. But you can see that that pales in comparison to the number of people that are eligible and want vaccine. And we all know people that are looking for vaccine very hard this week and have been. We expect it to continue to be challenging, probably for the next month or two, honestly, before we get enough vaccine to do everybody. So I think the most important thing you can do is to acknowledge frustration, help people find vaccine that is there. But if you cannot find an appointment, it is because providers don't have the vaccine to match to that appointment. And no provider wants to schedule a bunch of appointments and then have to cancel hundreds or thousands of people when that vaccine is not there. In terms of our capacity, so what if we got more vaccine? What happens when we get more? I want to assure you that we are ready to go. We, the health department, we, the hospitals, we, the pharmacies, we, the healthcare providers, health systems, FQHCs. For example, every week we coordinate with the health providers in the county that have been approved to vaccinate for COVID-19. 53 providers requested 53,000 doses from us. And what we had available to allocate out was less than 10% of that. So when we get vaccine, we have providers that are ready, able, and willing to administer over 50,000 doses a week. We are in DuPage focused on that existing 1B group. You've heard about the expansion that the state has announced to a second group of 1B. They're calling it 1B Part 2. These would be individuals 16 to 64 with underlying health conditions or disabilities. We are very excited to expand to that group, but at this point we are not expanding because we do not have anywhere near the vaccine supply to get to that group. And we don't want to create expectations from people that they're immediately eligible and should be able to find vaccine tomorrow because of the state announcement. So we expect to look to move to that group once the supply goes up significantly, demand falls off in the current 1B group, or we get through a substantial portion of that current group. The mismatch between our capacity and how much vaccine we have is not something that we have in our control. We don't just order vaccine from the state. They get an allocation from the federal government each week. They then decide how much goes to each county. So we've worked very hard over the past week to influence that. You may have seen media reports. You may have helped us to communicate that issue to the state. If you have opportunities to influence that, we welcome your partnership, but we cannot just ask for more vaccine and get it at this point. In terms of progress, again, even with our allocation of 4,500 doses this week, we've administered over 186,000 doses in DuPage County, which is incredible, and a testament to all of the different providers that are vaccinating in our communities. And DuPage County actually leads the way in the number of vaccines administered to people to become fully immunized at 5.8% of our population. So, there's always stories or the grass seems greener somewhere else to say, well, I hear they're doing something different in that area. Why don't we do that? We have been working very hard to build a provider network, to get vaccines here, to get them out. And I hope that that is represented here in the percent of our population that is fully vaccinated. We've gotten the people initial doses, and now our providers have followed up to make sure that they get that second dose as timely as possible. The other issue that we have worked very hard to get access to, and this group has been very interested in, is of course information about who's being vaccinated, right? So we know a lot about how much vaccine is here and where it's going and how many doses are going out. The other part of that we need to know and understand is who's getting vaccinated. This information is reported by each of the vaccine providers back to the state health department. And so we really rely on them to get this data. It's not something that we just have access to. And so Dr. Chug and her team has been working very hard with IDPH to get access to this data and to secure the information and then be able to analyze and present it back. So this is an update to the information we shared 2 weeks ago based on new information. I'm going to pause and see if Dr. Chug is on the phone and wants to talk about these.
Sure,
Rashmi?
thanks. Yes, thanks, Chris. Yeah, just as we try to summarize the salient points so far in the left column, basically that that these data do reflect who's being vaccinated, as Chris said, who's being vaccinated in DuPage County sites. So it looks like about half are DuPage County residents. So similar to how some DuPage County residents are that we know of are being vaccinated in other jurisdictions. Similarly, folks from other jurisdictions are being vaccinated here. Many of us live and work in different jurisdictions. Let's see. So I think most relevant for this group and one of our leading concerns is the high percentage of data fields that capture race and ethnicity being marked as unknown. So approximately half of vaccine recipients had race reported as unknown, and nearly 3/4 of vaccine recipients had ethnicity reported as unknown. Now, IDPHs, they themselves have greater abilities beyond this immunization registry data to kind of match behind the scenes with vital records and hospital discharge data. And so their level of completeness is higher. And we're trying to work with them to understand that and how we can have direct access to those data. But for now, this is a summary from the raw data that we're able to. We've only received it 2 weeks in a row, and we're trying to continue to receive it. And so we'll continue to, part of it is also working with our community providers and also patients to want to be counted. So very similar to the census, encouraging people to be counted and to represent themselves and their communities so we can better advocate. So, so I think that's an important point that we'll need to track. And that's the problem also in interpreting these data. I think we can, interpret them for what they are, but we also need to understand that they're not representative because they reflect less than half of our population. So I think race and ethnicity data, we definitely want to follow those over time and then work to improve, at least based on what we do know. That said, then moving to the next bullet, approximately 42% of first dose recipients are 65 years and older, and approximately 22% of second dose recipients are 65 years and older. And this is likely primarily a reflection of the phase 1A representing long-term care facility residents as well as healthcare professionals, and then now phase 1B includes persons 65 years and older as a priority group, in addition to frontline essential workers. So as we continue to move through phase 1B, we anticipate that percent of persons fully vaccinated in the 65 years and older age group growing, since they certainly are one of our priority groups who have been most disproportionately impacted by severe outcomes, including hospitalizations and deaths. The next bullet about 2/3 of vaccine recipients being female. It might be a reflection of the healthcare workforce. It might be a reflection. It's hard to say. We don't have granular level understanding of that yet. And then we're just beginning to track the types of sites, particularly relevant to the safety net. So this is FQHCs, which we know it's already grown in the past week, the percent that FQHCs are providing, as well as the health department. And then we had some incomplete data with regard to other vaccination types. So we hope to have that in the next report, and we'll keep you posted. Thank you.
Dr. Chug, thanks. We had a little dialogue going in the chat about the age representation, but that might be addressed. Leon, was there anything more that you wanted to ask about that?
No, I blanked on the healthcare workers. So when somebody pointed that out, that makes sense.
Good. And then, Chris, I want you to be aware that the questions popped up about how providers are prioritized. And I remember you addressed that in detail last week. Will that be coming in the presentation, or could you address that question now?
Yeah, I can get to that in a couple of slides. I
Okay.
will make sure to hit that. And yeah, the healthcare worker, we estimated there were about 43,000 healthcare workers in DuPage County who met that 1A criteria. So when you look at the number of people that may have been vaccinated early on, it is, obviously not as large as the 1B population, but a fairly large group that likely was vaccinated in those first few weeks. Okay, Dr. Chug, anything else here?
No, thank you.
Okay. And we do the IDPH site, and I neglected to put the link on here. These charts are pulled from IDPH's site that's updated every day. So this is the demographic data that they reflect, specifically about DuPage County residents. This does not include everybody that's been vaccinated in DuPage. Again, this is only DuPage County residents. This data is a little bit more complete due to some of the matching they're able to do with other data sets. But you can see a little bit more complete breakdown of race, ethnicity, age, and gender based on their data from the immunization registry. And it is broken down both by doses administered and persons fully vaccinated. So we'll put the link in the chat, and you can make sure you know where to find that and can access it and be able to monitor that over time as well. In terms of providers, so yeah, great question.
Excuse me, Chris, before
Yeah.
you go on, looking at this slide, I'm wondering, I understand that our elderly are is a priority, part of the priority group. My question then becomes, because of the disproportionate number of deaths and more morbidity associated with COVID-19 in the Hispanic or Latinx, as well as the Black or African American communities, and we see a disproportionate vaccine rate. Are these communities as well being considered priority groups? And the second part of that question is, because the governor lowered the, the age, I think starting February 25th, which might have been yesterday, widened the distribution. Is there any special, and he did that because, he did that because the studies show that Blacks and Hispanics are dying at an earlier age than our white counterparts. So what allowances are being made to get more vaccine to those populations where COVID is doing more harm?
Yeah, so it's a great question. I'll take the last half first. The expansion that the governor announced, at least for right now, providers in DuPage County are still focused on the 1B group, the individuals over 65. and frontline workers. So regardless of that new Part 2 group that the governor announced, providers in DuPage are focused on the existing group of 1B, and that's really the 65 and up plus these frontline essential workers. And we'll look to expand to that younger age group across the board as the vaccine supply goes up or we get through more of these individuals in the current group. In terms of how vaccine is being directed to communities that may have suffered disproportionate outcomes related to COVID, and I'll share more as we get into how we direct vaccine. But we're looking for providers that are caring for patients in those demographics, looking for providers and facilities that serve populations in very specific geographic areas of the county, working with the FQHCs and medical practices that serve individuals in those populations that you described, Janice, and not just using a mass vaccination strategy, right? So some places have said, all we're going to do are mass community sites, and we're going to drive everybody through them, and it's kind of first come, first serve. So our strategy in DuPage really has been to recruit and build this network of providers that serve many different parts of the population so that we make sure we get vaccine closer to where people might actually get their care normally and don't have to, adapt to a new system or battle with everybody at the same time for access. Does that help? And
that helps because I know that there was a vaccine event at DuPage AME Church on Tuesday, but I understand that was actually organized through the state, or was it through DuPage County Health Department?
Yeah, so we can talk more about those two events. I think Reverend Morgan is going to talk a couple minutes about that, and Evan Summers from Bensonville is going to talk about an event in Bensonville. That is another strategy. We learned last week that the state does have some mobile vaccine capabilities. And so we did work to connect them to Carroll Stream, to Bensonville, and to Reverend Morgan and DuPage AME Church for events that target populations that may not have had access as widely so far. So I'm hopeful that that's going to be a great tool for us. I think Reverend Morgan and Evan can share their experience, what they've learned, and as we figure out how best to use that, that's an awesome opportunity to bring vaccine directly to community groups or sites in the community that really need specific access.
Okay, thank you. One other quick note. Now, as we do that, and I sent a note to Ms. Ayala earlier this week, can you keep us involved? Because we want to make sure that those are successful events, and it may take us reaching out throughout the community to say this is happening, because for some of our church communities or community groups, promotion is not what they necessarily have expertise in, especially health promotion. So if you could keep us in that link, we can reach out to say, and as we did with DuPage AME, how many people have registered? Do we need to open this up to let other people know? Again, we want these to be successful events, but thank you.
Chris,
Yeah.
if I may, this is
Sure.
Rushmi. I just want to add 2 quick points. Is that all right?
Yeah, go for it.
One was, and Janice, thank you for your questions, and just wanted to also emphasize that prior to this 1B Part 2 expansion that the governor announced, that we are not able to adopt at this time, given the very limited supply of vaccine. You'll recall that previously, about a month earlier, he had announced the expansion of the 75 and older age group to 65 and older age group, largely for racial and ethnicity equity reasons. And that certainly mirrors the experience in DuPage County as well, where the average age of persons who died related to COVID-19 in our Black and Latinx populations are younger than 75. So we 100% agreed and supported and immediately adopted that expansion, which was applied statewide and now nationally, or at least in many states. And then just also wanted to emphasize that while vaccine supply is limited, we are very intentionally working on outreach to racial and ethnic minority groups within the eligible population. So certainly, as we all know, the 65 years and older groups and then racial and ethnic minorities are not mutually exclusive. So we want to make sure that we're reaching those within the eligible populations that overall, but absolutely prioritizing those that were most disproportionately impacted. So just wanted to emphasize our shared goals. Thank you.
Thanks, Rashmi.
Christopher, can I add something?
Yes.
I was really concerned about the numbers, especially in the Hispanic. I wonder why it's so low. I think they are the lowest vaccination applied in the page. I think they are so concerned about how much work they need to be applied in these groups, because we got people over 65, people that are working in the we could consider it the essential workers, and they don't have enough information. And also considering in the Latinx, many cultural facts that happen already, about the trust in the vaccine and not, and there are many barriers like language and how can they reach, many things like that they make me think that this is why this is so low, and how much work we need to do. As example, because I know there are other groups, but I know that the DuPage County, the number of Latinx population is pretty high, so high, and they don't reflect it in these numbers. So it's really concerning about that. But thank you, Reverend Morgan, and thank you, Jenny. Good questions, and I think the experience tech helped to improve these numbers. Thank you.
Yeah, that's a great point. And I think if you go to the website, we'll put the link in there, you can look at the percentages. The Hispanic or Latino represents, I think, 5.75 or 5.72%. And in DuPage County, I believe the number is closer to 15% of the population. So there's definitely more work to do to get to populations to make sure that they have equitable access. We're really interested and eager to get access to that data about where people are being vaccinated, both in terms of the places they're being vaccinated and where they live, to really break this down and make sure that we can either get clinics closer to people or make sure that the information is there about existing places. But you're right, these don't match exactly with what the percentages of our population overall are in DuPage. So yeah, thanks for highlighting that.
Can I ask a clarifying question around the data? I know that there are sort of separate streams that happen sometimes within our retail partnerships, and separately the vaccine that's administered through the county and the hospitals. Does all of that data bubble up into this, or is this reflecting sort of that county and state level administration and not necessarily all of the administration?
Rashmi, you've been most involved with IDPH. Do you want to share what you know?
Sure. So the data that are represented here reflect DuPage County residents, and we do not have access to these data yet, unfortunately, not for lack of trying. And we continue to try. What we've received so far are the data of persons vaccinated in DuPage County vaccination sites. We're continuing to try to, because what we want to understand is, not only who's vaccinated in DuPage County, but of our residents, who's being vaccinated, where they're being vaccinated, and what the rates are among those populations. So we ourselves do not have access to this yet. But I mean, I think what IDPH is providing here is certainly better than nothing. But yeah, so I guess the answer would be that we don't have a complete picture ourselves yet. Still trying.
Okay, thanks, Rashmi. Okay. In terms of the provider sites that are available to people, and this has really been one of our strategies, is to broaden the number of places that are receiving vaccine, make sure that they're distributed across the community, reflect different types of providers. We now have 111 providers representing all of these different sectors across DuPage County who are approved by the state to receive and administer vaccine. And that's really the key. So for any community group or community organization or faith-based group or municipality, these vaccines are obviously a medical product and have to be delivered in a medical setting by a medical provider. So linking up with one of these providers is the key to being able to bring these events to different places throughout the community. So as we break down the types of providers that are represented in that 111, I think it's helpful to know, who are these providers? Where are they? And so this list breaks down based on the information from the state about each provider, what type of healthcare organization they represent. And you can see we have a pretty wide spectrum of providers. but tend to be more heavily skewed towards pharmacies, independent pharmacies, retail chains, medical practices of internal medicine, family practice offices, federally qualified health centers, hospitals. So we have over 111 providers, again, across all these different sectors that are either receiving vaccine or will receive vaccine as soon as there is supply. Not all of these providers have been able to get vaccine yet. When you only have 4,000 doses, or last week we had 2,400 doses, you can imagine that doesn't go very far. We do expect those numbers to go up in the coming weeks. And so our plan is to be ready with all these providers and really work closely with them to make sure that there's vaccine available so that they can continue to reach out into their patient networks and community groups.
Chris, do you mind if I jump in just a second?
Sure. Yeah.
There was a question earlier on in the chat that this is really the right place to address it. It was from Laura regarding provider selection. And I just want to kind of recap what I heard you say. The list we just looked at are those who are approved, and they've gone through this vetting process with the state of Illinois to be qualified for a vaccine presentation. But the health department is going through another screen to determine who's actually getting the vaccine to put out there. And as you mentioned, you're using criteria that address the question of who's most at risk, what community areas are most at risk. You've got this list of qualities that you're using before you determine which one of those providers to send on vaccine to put into the community. So I wanted to make sure we got Laura's question. And forgive me, Chris, I probably didn't say that very effectively, but
Gotcha. Yeah, and I will share those criteria as we get through this. We'll share both the geographic considerations we look at and the specific considerations about each provider. So yeah, the providers are registered. They have either self-identified or we have encouraged them to apply with the state to be a COVID-19 vaccine provider. Providers have to indicate their willingness to do this to the state, apply for approval, and get through that before they're eligible to receive vaccine from us. So if you're looking at this map and see gaps or wonder about other providers, we would encourage you to work through that provider, contact them, see if they've been approved, encourage them to be approved to be a provider if there's somebody you know that has not yet been approved to administer vaccine. And again, our goal is to get provider sites across the county. These aren't locations that we go out and pick and say, oh, we need something right here. These represent the physical locations of those providers in our community who have been approved to receive vaccine. We have just this week, since the last time that this group has met, added some new information to our interactive dashboard. The link is on the bottom there that shows where these provider sites are located. It doesn't drill down into exactly what location and which provider, because at this point, many of them are not receiving vaccine. And some are receiving as little as 100 doses a week. And so they're very concerned themselves about being overwhelmed with thousands of people showing up. So we want to give information out about who these providers, where they're located, how many they are. And then you'll see along the bottom and the side more information about how much vaccine is coming into the county each week and where it's going. It's not enough, clearly. We all want more vaccine. We need more vaccine. But we're committed to sharing the information we do have about what vaccine is here and where it's going. So would encourage you to explore that data, and happy to take questions about that.
Chris, I have a question.
Yes.
Okay, I'm in the same boat with Reverend Miguel, because when an approved facility gets vaccine, the word gets out. And then it becomes a matter of who can register the quickest, who gets the word the quickest, who can get there the fastest. And often, and this happens on quite a few social media sites that are geared more towards white people, which, I'm on some of those sites, so I don't have an issue with that. How do we, if we can, how do we get the same information in a timely manner to our communities that are not necessarily, for example, part of what's happening in Naperville?
Chris, can I speak to that for a second? This is Kara.
Sure.
Only because I think we have some positive developments in that area. So this week, starting actually next Thursday, the DuPage Health Coalition and the Access DuPage program, which I think folks are probably aware is serving 96% Latinx and Spanish-speaking dominant patient population, is working with Jewel on standing up some special events that are specifically focused on addressing the needs of our 65 and older low-income, uninsured Latinx patients. So in fact, what you're describing, Jan, is a very messy phenomenon. And one of the approaches to address it, much like the AME event, I think over the weekend, although in a different focus, or earlier this week, I should say, is that we have a portal that's been set up very deliberately with Jewel that is not available to anyone else. And we have a week to reach out to all Spanish-speaking 65 and older and or Spanish-speaking 1A healthcare workers who are also uninsured, because we actually have dozens and dozens of Access DuPage enrollees who are working in healthcare as Division 1A. And so we are feverishly working right now and hope that we'll have a chance to do this many more times to reach out, not just to the patients that we're already connected to, but also to community partners who similarly have relationships with families like those we were trying to reach. And we'll be trying to do our part through efforts like that, and with the gratefulness of the partnership of Jewel in that effort to try to even the scales. That's just a clinic of 200. It's a pilot, but we are working all day today on getting those spots filled and hope that there will be many more events like that. Jewel has indicated strong support for doing so.
And if I can prep Evan and Reverend Morgan in a minute to share their experiences. Important to note on this map are these are the providers. These are kind of the fixed sites, providers that want to be able to receive vaccine and administer it when they're able. And so our goal is to recruit providers that can do this within their own patient populations and do community-based events. So if we can get vaccine to providers, and as newer vaccines are approved, first we had Pfizer that you had to take 1,000 at a time. Most medical practices can't handle that. Most small providers can't do that. Then we got Moderna, which was 100 doses. It allows different practices the ability to then work with their patient population. So it's not a free-for-all, sign up, for everybody in the community. They can really target individuals who are 65 and up, 75 and up, 85 and up in their practices, or those that are Hispanic or Latinx, or who are Black or African American. We want to get vaccine to them in their practices and for these community events. The numbers on the bottom here, the allocation by week, only represents the vaccine that's actually coming to DuPage County to allocate out to these providers. As you all know, because we've talked about it or you've seen it in the community, retail pharmacies are getting vaccine outside of this supply chain. IDPH last week unveiled their mobile clinic strategy that has additional vaccine that's outside of this supply. So those would be other opportunities to bring specific groups in and try to hit very targeted groups within the community for those clinics. And so Reverend Morgan and Evan, can I offer you the opportunity to just give a kind of an overview of what transpired last week and what you were able to accomplish in both of your areas?
Sure. Good afternoon, everyone. We had a pop-up clinic on Tuesday, and I call it a pop-up because it was a quick notice, and then we had to quickly mobilize, gather the volunteers, and we had the opportunity. The event was on Tuesday, the 23rd, and we were able to service 222 persons. We actually had to turn away 4 people, and it was a great event. We learned a lot of things from going to visit the Bensonville event on Sunday. And so we were able to kind of get a heads up on as to what was going to work and what was not going to be effective. And so we adjusted our initial thoughts on how the flow of people coming in to receive the vaccine and the whole operation, basically the workflow would work. And I would say it was successful. We definitely did not have any vaccine left over. We had, again, as we said, we had to turn some people away. We only had one incident of a bad reaction, but I don't think that was related to the vaccine. It was related to that individual person's health. But it was very well supported. We felt like we had everything that we needed to have a successful event. And the community has been grateful, and we've received a lot of accolades to that effect. We're ready to host again.
Can I ask Reverend Dixon a question?
Yes, please.
This is Leon Kronos from Navistar. I'm just curious, was your event predominantly African American?
I would say yes. If I had to give a percentage, I would say it was 90% African American.
So did you have an opportunity?
Probably higher.
Did you have an opportunity while you were there to discuss with the people that were getting the shots, any hesitancy? Or did you were just given shots?
we were giving shots. I think the people that were there, we only had one or two that expressed their hesitancy coming in, and mainly because we know them. Many of them were our parishioners, and I would say about 85%, maybe to 90% were our parishioners.
Okay.
And so we had already an established relationship. There were
Okay.
a couple who I knew in advance, and we fielded a lot of phone calls. I calmed a lot of anxiety, tried to at least. For those who were not quite so sure, they were excited that it was being held at the church, a place where they trust.
Okay.
And they were excited that we were on board with it. Pastor Miller, Reverend Lana, and even myself, I actually fall in the 1A group. And so we all got the shot first.
Okay.
So, no horns, no tails grew immediately. So I think everybody was excited about that. But I think we tried to anticipate some of that, but we didn't have a whole lot of that. We had one person who did not get a chance to do it because his anxiety was too high.
Okay.
But I don't think that was related to, I don't think that could have been avoided.
Yeah. No, a fantastic event. I was just curious. I mean, obviously in our community, there's, at least this, it seems to be, I know my two sisters won't get it, which is frustrating for me. So I was just wondering if you had a chance to get that, but thank you very much and congratulations on that.
Thanks.
I can talk about the Village of Bensenville. Well, it was rather located in the Village of Bensenville. It was not sponsored by the Village of Bensenville. A week ago from today, last Friday, Chris Hoff called me and said, "Hey, did you know about this event that's happening in your town on Sunday?" And I said, "I have no idea what you're talking about." But he put me in touch with the people that I needed to get in touch with. So the event was held at, we have a large Hindu temple here in town. The event was targeted at Southeast Asian population. About 250 people were vaccinated. There were some lessons learned there. The temple being a temple, they wanted everyone to take their shoes off. So that did complicate things a little bit for IDPH, I think. In working with IDPH since then, we're working at setting up another event. I'm aiming for March 13th. I do just want to give a shout out to DuPage Health Department. I think I've grown accustomed to your methodical and steady march forward on vaccination. IDPH is a little bit different in that approach. It's more kind of ready, set, go, and we'll figure it out after the fact. So I do think we all need to owe a debt of gratitude to our health department for how great they are. I've dug into it a little bit more. This is an actual initiative. IDPH is calling it the Equitable Vaccination Initiative. It's aimed at hard to reach populations as well as marginalized and underserved racial and ethnic groups. So it does look like it's going to be replicable. It doesn't look like it's going away. Interestingly, and this is probably me just opining a bit, but nowhere in here does the Equitable Vaccine Initiative mention it's only for 1B populations. So this looks like they're really trying to get the gross numbers of marginalized, hard to reach, and minority populations up in the state of Illinois. So I think that's just a tidbit that's interesting to take note of. There is going to be a way that IDPH will start advertising this where you can apply to have an event with your select population. It's a little difficult though. You need to prepare yourself that you will not get a confirmation of your event until the Friday before that event. So you may have at most 8 days to try to schedule something, to try to set up this event, which is going to be difficult just because they don't know how much vaccine they're going to get. So that's just my word of caution. And there is the opportunity too. They offered me the National Guard for my event. I turned that down. I didn't think that'd be appropriate for a predominantly immigrant population that we're trying to vaccinate. So we turned that part away. But hopefully IDPH steps us up and formalizes this process a little bit more so we can get it out to everybody in the Heart Group.
Yes, thank you, Evan, and thank you, Reverend Dixon, and appreciate the appreciation, but you are the ones that pulled it off. So we're glad to make the connection. We will certainly be working with IDPH to clarify the details around this opportunity. And then as soon as we have some confidence in making sure that it will work and not create undue burden, be able to share that here and really take advantage of it as much as we possibly can here in DuPage, because it is a great resource to be able to bring vaccine directly to communities at places they feel most comfortable. So thank you both for sharing and thank you for organizing the work you did. All right, I'll keep us moving forward and then I'll put the slides in the chat so you guys can review these. I know we're short on time, Dave, so do you want me to stop there? Do you want me to zip through?
Oh, please zip through. The data part is crucial to our work. Thanks.
Okay, then I will try to be brief on each of these. This slide shows the number of first doses that we've received in DuPage County each week. And you can see that we've been on a steady decline since middle of January. So if you felt that frustration rise in the community, if you felt it yourself, we feel it too. We did not expect to see declining amounts of vaccine over the preceding weeks. The good news is that we expect more to be coming. We have received some projections from the state. Next week, we expect to see about 8,000 doses here in DuPage County. And then I think the following week, we're projecting about 12,000. Those are not final yet. We don't know until they're finally communicated to us, but that's an encouraging sign that vaccine will become more available. And today, the FDA's advisory committee is meeting to review the Johnson & Johnson vaccines that may be added to our opportunities to expand vaccine in DuPage. Of note again is that this is the vaccine that is represented as coming through the health department for allocation to those 111 providers. It does not represent vaccine that's coming to retail pharmacies from the state or federal government, or vaccine that's going to other groups like IDPH for their mobile clinics, or some of these other pathways that even we are still discovering. So we are interested in a complete picture of the vaccines in the county, and as much as we have, we'll share with all of you. One important note, and I think you may this week have seen some reporting and media reports on inventory on hand. The state does report for each county how much inventory on hand is available. The most important note about this that I want to share with you and ask for your help in communicating is that in that third column, total reported inventory, it appears that DuPage County has 56,000 doses that are sitting around waiting to be used. The reality, and we work very, very closely with our providers to make sure they're moving vaccine as fast as possible. The reality is that over 80% of that inventory is for second dose appointments in the coming week for individuals that have already received their first dose. So those are not vaccines that are available to expand into more people. The remaining inventory will be used in the next 5 to 7 days, and providers are moving very quickly to get that vaccine out. So don't want anybody to believe that this is inventory that's just sitting around, that somebody's not moving fast enough, that hospitals aren't doing enough. Providers are working very, very hard to move this vaccine as soon as possible. So this is an important snapshot. It tells us what's here, but doesn't necessarily reflect how much vaccine is readily available for use today. When we get our weekly allocations, this gets to the question, Dave, about how do we prioritize providers? So Laura, this is for you. Every week we learn about what our allocation of vaccine will be. We are then in immediate contact with the array of different providers that have indicated their willingness to vaccinate as part of this effort. So all of these different provider types we're in direct communication with to ask how much vaccine they need, what's on hand already, what are their plans for the coming week. As you saw from the second slide, last week we had providers ask for 53,000 doses of vaccine and we had 2,400. So we have to make decisions about where that vaccine will go. The considerations we use for that, so determining who will get vaccine and where it goes, are based on a couple of considerations. One very important one is that we look at a tool that CDC has put out called the Social Vulnerability Index that rates each of the 200 census tracts in DuPage County on a number of factors, including unemployment, minority status, disability, transportation, language, and several others. Each of the tracts then is ranked. So the darker the color, the higher social needs of that area. So these don't come as a surprise to any of you, I'm sure, but it helps to put it on a map to really display and document the areas that we need to be focusing. And so if clinics are held in these areas, if clinics are drawing people who live in these particular census tracts, they will receive higher consideration for vaccine in the weekly allocation. The other considerations that we ask each provider to tell us about week to week is whether those clinics will be open to all of the community or just a particular group, just teachers, just grocery store workers, just any sector, or open to anybody in that group, the current group that's eligible. We are looking for individuals who are living in or working in those census tracts that are most highly impacted. And so if clinics are drawing people from those areas, that weights higher. If the clinic itself is located in one of those areas, we want to get vaccine to those areas so that they can use it, again, for people generally living in those areas. It's not perfect, but it's a way for us to direct vaccine to areas that need more attention. And finally, we want to make sure that clinics, and we have asked clinics about their populations. We want to target areas that are serving people who have Medicaid or who are uninsured, making sure that they have plenty of access to different clinics around the county. Or if a clinic is serving a very high priority group, a residential group home for individuals who are disabled, for example, they may have higher weight to their allocation request that week. Now, hopefully we get more vaccine and these become less important and we can give vaccine to everybody. But until we do, these are the factors that we're using to try to drive vaccine to providers who are reaching these populations. In terms of the timeline, I want to reiterate again that we have said and will continue to say that we expect this phase 1B group to take probably 3 months to get through, which puts us, through the month of April. So hopefully we can move faster. The state and the feds have said there's more and more vaccine coming, but the reality is that even if we double the amount of vaccine we're getting from 4,000 to 8,000, we can't move substantially faster. So really helping manage expectations for people that even though you're in that 1B group, it may take weeks to get vaccine to everyone based on the very limited supplies that we're getting. So I know nobody wants to hear that. It's frustrating to hear that you might have to wait until March or April. But I think we want to be honest with people, because setting everyone up to expect that they'll be able to get vaccinated by next week or the end of February is not realistic, and it doesn't help understand the process that is taking place. I did mention this at the outset, but we'll just reiterate that in DuPage and many of the other counties around Chicago, there will not be an expansion to that Part 2 group until the vaccine supply goes up. We already have hundreds of thousands of people that are eligible in that phase 1B group. And the idea of adding another 174,000 people in that Part 2 group means that it doesn't mean that we'll move any faster. It just means that more people will be expecting to have access immediately, which is not reasonable given the very small amount of vaccine that we're getting. We will absolutely move on to that group as fast as we can, and the considerations that we're looking at are listed below there. So when we see significantly more vaccine, when most people in the current phase have been vaccinated, or when demand falls off and we know we can move on to the next group. The last thing that I'll leave you with is links to our communication tools. So as it's helpful to draw on these for your communication with your clients, stakeholders, partners, please do. If there's things you don't see that you think would be helpful, let us know, and we are happy to put those together and share them with you, or to draw on the tools that you have put together, and then we can share them as well. So with that, Dave, I will end. Happy to take questions in the chat. I will have to get off, but Mila can get questions, and I'll put questions in the chat or the presentation.
Thanks so much, Chris. I know you've got to run. There's one question that I think we want to try to give to you before you get away. And that has to do with, now we know that the state is standing up the pop-ups, and we know that you're supporting that, and we know you've got your whole set of providers. Reverend Miguel asked the question, so if my group wants to set something up, what's my next step?
That's a great question. For IDPH, we're working with them to figure out how best to relay partners to them. The 2 sites that happened early on, they had already identified. So we're going to work on that process to understand how to submit organizations or to connect you directly with them. In terms of Jewel or some of the retail pharmacies, as we work with them, we are collecting information from community groups who are interested. So we will put information out to this group about how to do that. You can send it to us now, any of the health department staff. It has been very ad hoc, honestly. These retail pharmacies have been receiving vaccine that's outside of our process, and they'll pop up and show up in a community. So we're working hard to try to match those 2 communities or organizations. So if you have a particular interest, I think the information Evan and Reverend Morgan shared is, find your space, figure out who you're going to invite, have the logistics kind of ready to go. Because as much as we'd like to pre-plan these opportunities, many of them have popped up with 48 hours to pull something together. So any pre-work you can do now will help to do that. But Reverend Miguel, we're happy to take your information and make sure that we can connect you to an opportunity as it's available, and anybody else.
So Chris, if you need to run, this next one might be able to be handled elsewhere, but Dr. Asfar asks about those clinics that are available to community members. Is there a list available?
Dave, I saw this question. It's Mila. I don't have a list that's open to the community at large. Each of these events have been very targeted. I think Reverend Morgan and Evan kind of shared how they work with Illinois Department of Public Health. And while 200 or 250 doses seems like a lot, even I think for those 2 groups, it was very difficult, I'm sure, to pick 200 or 250 people to participate. So not yet, I think, is probably the answer. And Chris and Adam, if you're still on and you wanted to add anything, please jump in.
No, I mean, the only thing, there are a couple resources listing all locations. The state has a site, I was working to put that in the chat right now. And then we know that the CDC just launched a tool as well. And I'm gonna put that link in the chat as well. But those are kind of global, and they're listing all sites, and you can kind of search geographically. But you kind of have to still do a little bit of probably individual or independent work to see, okay, is that a site that has appointments currently available and open to the community? But those are kind of the best centralized resources that we have so far.
And Dave, I see Don Desart's hand up. I don't know if you can see that.
Member Desart?
Thank you. I'd like to read to you an email that I got today. And I get emails like this almost every day, but when will DuPage County get enough vaccine doses so that group 1B, 65 and older, can get our shots? I've worked my phone app, my iPad app, called and emailed DuPage Medical Group, even phoned Walgreens sites that had vaccine 2 to 4 weeks ago, but don't know when they'll get more. And at age 74, I'd like to get vaccinated soon. Any updates on plans to vaccinate at the DuPage County Fairgrounds? That would be a good central location, or do you think I need to go to the United Center?
I could try to respond to that. I think I remember to start. We also get those kinds of emails daily, so I certainly understand. And as you know, Chris sort of provided the broad context for the situation.
He did.
We have lots of that. First, I think most of this group, if they don't know, we are operating at the DuPage County Fairgrounds now. We've been limited in the amount of appointments we've been able to offer, just being limited on supply. That said, we were using sort of the algorithm that Chris identified from the CDC, where we're not really moving from one group to the next until we know we're about 60 or 70% of the way through, at least estimating. And when we did that with 1A to 1B, we were maybe a week or so behind when the governor said to go to 1B. So we were still focused on those 1As. As we've moved into 1B, we have really tried hard to primarily not sub-prioritize groups, particularly when it came to the occupationally based frontline essential workers, because they're sort of all weighted equally. But the one thing we have done is sub-prioritize 65 and older as much as we can. And the couple ways that we've done that is by offering the sort of phone-based scheduling option for those that are 65 and older, because we're very cognizant of the digital divide. So anybody who is concerned should absolutely call us. We can help them register, and they can also be marked as like they only want to call back. We understand a lot of this stuff of just sending out emails isn't going to work for everybody. So they can say that they want to call back from us. And then the second thing that we're doing is, when we do get some supply and can start offering appointments again, we are carving out a percentage of those and making sure that outreach goes directly to those that are 65 and older first. And in the last wave, we got I think about another set of 1,000 roughly, and we had set aside about 70% of all of those appointments for those that are 65 and older. And in fact, those phone calls to those individuals have been happening for the last couple days for appointments that are scheduled early next week, Monday, Tuesday, and Wednesday. And that's something that we're committed to continuing to do as more doses come in, that we prioritize the outreach and give a healthy percentage of what we have available to those that are 65 and older, and continue to do that way, and continue to offer the intensive phone-based assistance as well, because we are finding that that's working much, much better.
Okay, thank you so much.
Of course.
Adam, maybe you can address this, or Kara. I like the ideal of setting up a more aggressive approach at the Jewel grocery stores. My concern, however, is in some of our areas, particularly in Addison and other areas where we may have a higher percentage of Latinx people, we have food deserts. So are we, if we're going to create that communication channel using Jewel, are we also considering any type of mechanisms to address barriers such as transportation? I see Kara has an answer.
Yeah, for sure. Not just, so first of all, Jewel is an example. It is not the solution. I'm trying to set up things that look and sound like this with every partner and partnership that's available. So that means that, and that it also doesn't mean looking only at bricks and mortar locations, but also looking at partners that are willing and able to bring a resource out into the community. Jewel, and not only Jewel, again, using it as an example, has hosted events out in the community already, and it's clear that there's an intention to continue to blend these sort of retail appointment settings and something that looks a little bit different. We also hope that over time, what we'll be seeing is an array of appointment slots that can be set aside for disproportionately impacted communities so that we can find a location that is closest to them. But the last thing I'll say is that a number of folks, I think we even talked about it at an earlier meeting in regards to this pandemic health navigation project and the fact that there is a lot of funding that is available for a short period of time to try to support health navigation efforts. I can say that our grant, and I hope others like us, has built in a fairly significant portion of our budget to include things like transportation vouchers, so that when people have an identified barrier that is the distance or the delta between them being able to get to a vaccine and not, that we have some tools to be able to help with that.
If I could, I want to note, thank you very much, Kara, and thank you, Jan, for that question. I'm noting that we're at 3:07, and we've had a fantastic exchange around how to manage this current circumstance where supply is low, and we still want to make sure that there's fairness in getting the available vaccine to the right place. Within a few months, the script will flip, and we will be in a position where there will be adequate vaccine, but we'll be trying to figure out how do we build confidence in communities to come forward. And I want to make sure that we do our strategic work today in anticipating that. Kara and Mimi and others have put some work into doing a survey that's going to help us be prepared when we get to that point, when we need to be building confidence, and there's there's adequate supply. And so I want to ask that we set this aside now. If you have additional questions, please do put them in the chat and we'll find a way to respond to them. But I want to make sure that we give Kara and Mimi a chance to tell us, how do we get engaged with the survey on behalf of our constituents?
Mimi, do you want me to tackle, or would you like to? I've talked a lot today, so please feel free if you want to.
Yeah, I can jump in. That's fine. So we have launched, as many of you know, a vaccine confidence survey in the past couple of days, and we would like to continue sharing that out. So we wanted to share our preliminary process, where we're at so far, and then make a plea for your help as well. So in the past 2 days that it's been out, and some of you have all shared out already, so thank you so much for your support in that. We have about 1,100 responses already, which kind of exceeded our expectations. That's the really good part. We can see that there's a healthy appetite for sharing feedback with us and for the community letting us know their thoughts. Where we have more work to do is looking at the equity of who's responding and how that reflects or doesn't reflect our community as a whole so far. Now, granted, it's very preliminary, but at this point, I would say, if I was to broadly summarize it, our respondents so far are disproportionately white or Caucasian, disproportionately female, and of sort of a middle age range. So I would affectionately say the soccer moms are responding to our survey, but we want more than those folks. We want everybody responding, because we need to know everybody's thoughts and able to respond adequately. So this is the point where we would like to call upon you all and say, what are things that we can do to boost this response to more folks and a more diverse body of people and a more equitable body of folks, and what are some tangible steps that we can do as a group to make that happen? So I'm going to sort of open the floor to that discussion, but it would be great to get some just tangible steps of what we all can do towards that goal.
Hey, Mimi, could I jump out? It's Mila, and just say that looking quickly at that, the health department will do some boosting and reach out to bilingual avenues and things like that right away. and then listen to you all for, direction on what else we can do.
Perfect.
I want to extend an offer to folks that are on this call. We've had some conversation in the past in regards to text messaging as a strategy. And I don't know if there's anyone here, especially working with linguistically isolated populations as an example, who would like to employ that strategy, but is not currently within the capacity of them to do so. I have a limited ability to help with that. Text messaging has been incredibly helpful here at the DuPage Health Coalition in reaching out to our predominantly Spanish-speaking population. And it's not an expensive tool for us to use. So if our partners on this call would like to be able to work with us, share some contact phone numbers, and figure out some messaging that we might be able to push out on your behalf, we can, at the header of the message, identify that this is coming from St. Mark's. It doesn't have, it's not going to be that it would be identified by us. That's not our goal or interest. And we would be happy to share that survey, therefore, by text message, and let people that have smartphones complete it that way. Here is the limitation, which I hope to have solved in the next week or two, but I can't probably solve this week before the survey closes. Because we've always used this tool to reach a predominantly English and Spanish speaking population, we learned that the technology limitations of what we have today only allows us to share text messages using the same alphabet that is used for English. And so I'm looking at you, Dr. Asfar, because I would love to actually be able to work with you on this, but I can't share today in Farsi or Urdu or Arabic. I can't imagine that that isn't an upgrade that's possible for us. I just don't have it at this moment, so it's not helpful to you. That being said, as an example, over the weekend, we'll be sending this survey to 5,000 of our Spanish-speaking members of either Access DuPage or Silver Access. And we certainly hope that that helps to boost up the number of Spanish-speaking respondents to the survey. Would love to hear other people's ideas about how we can connect and what you are intending or perhaps have already done to try to help us with this effort.
I wonder if I could gently ask Claudia and Chrissy, here you have your good experience working with diverse populations and communicating in a multilingual way. Do you have any advice or thoughts or guidance for us in pushing this forward?
We have shared this to our Facebook page, and that's in English, and we've also shared it in Spanish. The primary language other than English for our patient population is Spanish, so we've been able to utilize that.
Excellent.
We shared it in the WhatsApp group. Sorry. Please continue. I'm sorry.
Oh, that's okay. Go ahead.
So I was just sharing that we shared it on WhatsApp message yesterday night, and I hope people were replying that done. So I think English might also work with those who have students at home and they can help their parents. So I'm excited if we can use this, opportunity.
And if I think about responding to this, it's different than the vaccination. That is, every additional response from a diverse corner or part or center of our county helps us. All the data is good. And even if one population responds with greater frequency, we need the representative voices as well. That will help us. And I thank everybody who's doing that work to seek that input.
David, if I may add, it's Kim Siebert from the Health Department. We recently boosted the survey in Spanish on Facebook, and we targeted Spanish speaking individuals as one of the items to reach out to people and show up on their Facebook feed. We're also looking to partner with our digital media partner to advertise on some very specific platforms to reach targeted audiences, so we can try to gain some additional participation in the survey.
Fantastic.
Kara, do you know, did this go out to the COD, to the college?
I don't know that it did go out to COD, and actually we were having a conversation in the meeting immediately prior to this about making certain that it went out to all of the complete count committee members from all of the, both at the county level and respective municipalities. I know if we are successful in that effort, it will get to COD. That's one of the audiences.
I can send it to my contact at COD. I'll just share that with you in the chat.
Thank you very much.
And Dave, it's Mila. We also talked about if there was ways to reach some employers that would be interested in getting it out to their workforce, or, you know, if there was a way to get a little deeper that way. I know we have some on here today, and I don't want to put them on the spot, but we also wanted to reach out to some chambers potentially. So if anyone on this group has some influence there, that would be great. Mayors and managers, I don't know if Kim already mentioned this, but mayors and managers has included this information to go out next week on their social media outlets. And I think all of the municipalities have public information officers that also receive this information. So that probably hasn't hit yet either.
Very good. A lot of effort, a lot of push, and an incredible number of responses.
Can I just ask, are there areas where people feel like we've missed that we should include?
I think schools would be good. I asked last time too. I think we should reach out to schools because you know, most of our clients, they don't have social media. They might not have, you know, other resources to find out. So students can help their parents.
It's a great idea. We shared it with the ROE and asked them to distribute it throughout their networks. We also have a network of bilingual educators that we send out messaging through, and we're sharing it with them as well. But I do think, Mila, that the health department also did some sharing, and some of the districts have picked it up and shared it already, right?
Yes, and Dr. Esther, I'm thinking about what you said, because I know it's been shared on District 88, 200, 203, all of their Facebook pages. But again, if those parents don't have access, right? So I'm wondering somehow if we need to get in some, if there's time to get it into some of the backpack type stuff, or maybe talking to the liaisons at those schools to get a little bit deeper. So that's a good comment. So thank you.
Schools have that system that they send out messaging through on the phone, and they send reminders, like God forbid any incident happen in the school. So if they can share that messaging through school department, I think that would be helpful.
No, that's very good. Thank you.
And Chrissy, in answer to your question, we're pushing it through. We have about 250 interpreters in about 43 languages represented at DuPage Federation. So we're pushing through that group into their various constituencies.
Great, thank you.
Hi, Mila, this is Glee.
Hi, Glee.
As employers, if we would be interested in participating, you know, in that survey, do we just reach out to you? And the results of that survey, is that something that we would be able to have access, or, you know, the results, are we going to be able to get it as well?
Yes, and so Glee, yes, definitely. We can talk about it offline a little bit more, but you would have access to the full results of the survey, and we can talk more about that.
Okay, great, thanks.
No, thank you.
Great question. Dr. Asfar asks the last date. It is Sunday a week, so March 7th. So there's still plenty of time if you are wishing to share and have ideas of places where it can go. It can be shared now, and it could be shared more than once between now and then. And I think that sometimes, I don't know if other folks on this call are like me, but sometimes I need to see something a couple times before I'm sufficiently impressed that this is something I want to pay attention to. So encourage you to share it, but also consider sharing it again as we get closer to that deadline.
David, we are trying to communicate with our community. I'm just thinking out loud because we are providing services to 14 nationalities, including everyone, irrespective of race, religion, and ethnicity. So it's very challenging. At the same time, we have few resources. For example, we have a mobile clinic. Through that, we do health screenings. And we have good amount of volunteers. And we are, I'm just putting it up here, like if we can be helpful for health department, for vaccination, for education, for any way, you know, all of us have to work as a team, and we are trying to. So, you know, let us know how can we be helpful for vaccination, especially because I'm thinking in two directions. One is trying to bridge the gap with these communities. And at the same time, I want to offer something like, hey, this is the location where you can get the vaccination if for those who are very concerned. So really, I think if we can sit down together with a couple of maybe Mila and, you know, and sit down and figure this out, because we are receiving many families who need food and other services, and you know, things can be better.
And you have those assets. You've got the mobile clinic and you've got the volunteers. So we need to find a way to activate those around these goals. Thank you. All right. Anything else we should touch on this survey tool? So the question about will it be available? Will the results be available? Did I hear a response there?
Dave, we will make the results available to everyone. We'll bring them back to this group, and we're thinking that the subcommittee for communications will meet around March 10th, and we would have results at that time and then prepare them for this group.
Thank you.
Dave, can I take one more moment? And I think Sophia was on this call. If she is, I'm curious about your feedback, Sophia. I don't think that Maha is on this call, but I'll follow up separately with Arista. We have one Mandarin speaking respondent so far, and so we certainly want those numbers to go up as significantly as possible. So I wonder if you have any recommendations or suggestions, and please wanted to offer up our support if there was anything we could do to help in efforts to get it out to that community. We know that it is significant and that there are also a fair number of seniors living here in DuPage County who are Mandarin speaking, and so we want to make certain that we're connecting with that group.
Sure, thank you, Kara. Yeah, I'm here. Yeah, I shared with our working group about the survey link yesterday. I myself submitted in the first place, but I submitted the English version. but yeah, so I promoted the survey for sure internally. So I asked for our adult daycare service department to make sure to tell our Mandarin speaking client seniors to click on the link and select Chinese specifically. So yeah, so once I got that link, I shared it on our Facebook link. Yeah, so I will push that to both of our adult daycare and in-home care service team to make sure that all of our clients, mostly seniors, are aware of this survey, because I told them that it's really, really important to hear back from them what their concern is. It will only help our government to assist us better. Yeah.
Thanks, Sophia.
Sure.
So, Kara and Mimi, if it's all right, I'm going to move us now. It's 3:25, and I want to give Mila a chance to tell us what are the upcoming events and communication tools that we can be connecting with.
Sure, Dave. And you know what? I think I'm going to provide a little bit more on this in the email update to the group, just looking at the time. But we are close to completing scripts, which have been developed with the influence of the CDC messaging, and are looking at several different scripts that will be used in PSAs. So Kim is also on the line, and if there's time, she can talk about this too. But the plan here is to put together some PSAs, and I know I also wanted to give Jan a chance to talk about some of the PSAs that she had sent out to the group that were done with her Edward Elmhurst connections as well. So the real update here is that we are almost ready to begin recording, and the scripts are in development, and Jan has already jumped out and done some PSAs. So if Jan, if you wanted to say a word or two.
I will say a word or two. Anyone wanting to use the PSAs, you're welcome to do so. If you have an interest in developing others, you can contact me, and I will refer you to the company that did ours. But we've gotten a wonderful response from them, and I've sent them to you, right, Mila and Kara,
Yes.
and others, and David. So anyone who wants to use them, Reverend Morgan, did I send you some as well? And I will send them to anyone who wants them, and feel free to, we encourage
Jan,
you to use them.
I can include it in the update to this group so they all have it, to the video link that works for
Okay,
you.
great.
Okay. Yep. And Dave, regarding the events, we were going to kind of walk through the events that had just happened over the last 2 weeks, but we can put that into a different meeting agenda and wrap up with your next closing statements.
Good. That sounds very good. At 3:27, there has been so much good that has happened coming into tonight. I'm thinking, I'm looking at Jan, I'm looking at the recent DuPage and AACP event, and there are others. I'm looking at Phil, the American Heart Association event. A number of good things have happened to inform the community and promote vaccine confidence. Thank you for that, and forgive me for those who I'm missing. To all of you who are on the call today, thank you so much. What great input, ideas, challenges, and expansions that you're offering for us to be able to accomplish our goal. Special thanks today to Kara and Mimi for this incredible survey. We see the results already, and this is going to set us so well for the long-term strategic need to build vaccine confidence down the road. So thanks so much, all of you. We're anticipating a longer interval this time before our next meeting. We're going to look at March the 19th, Friday, March the 19th for our next meeting. I'm looking at my colleagues to make sure that still fits. So 3 weeks rather than 2. Today, you learned some important things about opportunities to stand up clinics, to get survey feedback, and I just encourage you to engage with all of those opportunities. Thanks so much for that engagement that you've already done. That's why we're cooking right now and we're doing well. Thanks for your engagement here. So is there anything else that we should touch on before we close off the meeting today? Also, Communications Subcommittee, March 10th at 1 p.m. Thanks, Mila. All righty. Nothing else to hear. We're adjourned. Take care.
Thank you, Dave.